Well, good afternoon, everybody. Now, I know the issue du jour is obviously what's going to happen later this afternoon, this evening, particularly with some of our relentless focus on the tax credits, the ACA tax credits. But what we're here to talk about today is actually an additional front on what seems to be a uniform and united attack from President Trump, his administration, and congressional Republicans to cut back on the affordability and availability of Americans' health care. I've seen it in my state, in the reactions to the big awful bill, where we have hospital systems literally shutting down rural health care clinics already. Not in the future, not imaginary, but directly attributing it to the consequences of the big awful bill. We've seen it on the efforts to gut outreach efforts, to gut enrollment assistance. And, we obviously are now further debating the absolute disaster that's going to roll out at the end of this year with the expiration of the premium tax credits. And I would point out on that, we're also starting to see, I think, efforts from the administration to delay the letters going out, to hide the fact of these enormous rate cases. I can tell you in Virginia, we've looked at examples where a couple making, folks in their 60s making $80,000 a year in Virginia Beach could see premium increases of $800 a month. Outrageous. And, on top of that, I just think one of the things we need to do a better job at is, whether it's the Medicaid cuts or the premium tax credits, this is not going to just affect those folks. You add this many folks to the uninsured pool, and spent a lot of time on this as a former governor, it is going to drive up rates for everyone. This is a wholesale attack on health care. The issue Senator Wyden and I are going to talk about today is actually a rule that came out from the Trump administration in June. And certain entities have brought it to court. There was some restraining order put today, but it is going to be devastating. The so-called Trump administration, or the Trump's administration's so-called marketplace integrity and affordability rule that came out in June, I can assure you is anything but. This rule will actually throw up more bureaucratic barriers, add more paperwork costs, and keep families from staying insured. What I want to cite before I turn it over to Ron is, don't take my word for it, please. Do not take my word for it on these charges and these claims. Look at what the Trump administration itself has said about the rule. According to CMS, this rule would raise premiums for working families by about $3 billion a year. Millions of Americans would see their premiums and out-of-pocket costs rise literally on an individual basis by hundreds of dollars. And up to 1.8 million additional folks could lose their coverage. Now, that's not from the Senate Finance Committee. That's not from me. That's from the administration's own estimates. For example, one of the bureaucratic hurdles they're putting in place with this new rule would add more than 15 million hours of red tape and paperwork, both for folks who are doing the enrollment, and a state like mine sometimes comes into the local government, but also obviously from the families that are trying to re-enroll. They would put additional charges on place and would put just a lot of bureaucratic barriers. That's why Senator Wyden and I and more than 40 of our Democratic colleagues are introducing this Congressional Review Act. And we will be bringing it up over the next few weeks, regardless of how the current debate goes. But our CRA amendment, and we've heard from my Republican colleagues concerned about this, but it would reduce premium and out-of-pocket costs. It would lower the annual out-of-pocket limits by up to $900 for families with ACA or employer coverage. It would eliminate the new re-enrollment fee, and it would, at the end of the day, just continue to provide the access. It has taken us a long time to get where we are on the ACA. There's always areas to improve, but to kind of put these bureaucratic hurdles in place, and that's before you even talk about the Medicaid cuts, or even before you talk about the premium tax credit expiration, is evidence that, this administration is dramatically trying to cut back on Americans' health care coverage and drive up their costs. It's a pretty simple argument, and we'll have an opportunity to present that to our colleagues over the coming weeks. With that, I'll turn it over